Well, good afternoon. My name is Paul Temple. I'm the rector here at the Church of the Redeemer, and I welcome you, and I welcome the cause which you represent today. I view my participation today as faith-based, political, and personal. It's faith-based because I believe that in many faith traditions, including my own, health and wellness is God's will for all people. It's political because I see politics as nothing more than ethics being lived out in the public arena. And it's personal because of a story from my own family. Right around this time of year in 1996, my wife and I were living in Louisiana, and my daughter Leah was at Rutgers University. She attempted suicide, and we were called to her bedside and eventually had to have her involuntarily committed to a mental health facility. Our insurance company paid for a 72-hour stay in that hospital. Leah later told us that had she been able to stay there longer, the treatment that was offered to her would have made a real difference in her life. She had 2 more subsequent attempts, and she died in August of 1997 from suicide. I'm here for the sake of Leah. I'm here for the sake of Melanie. I'm here in the hopes that we can do better than this. And I'm here in the hopes that we can be part of the solution instead of part of the problem. Thank you for your devotion to this.
Recently, a few weeks ago, a couple of months ago, I admitted a woman to the hospital who basically had a severe infection on her leg. And this infection just didn't happen overnight. It started months ago, months prior to that. It started as a small wound that was being taken care of by her primary care doctor in the clinic, wound care and whatnot. It was doing well. The woman lost her job. A few weeks later, she lost her insurance because she lost her job. And then a couple months later, she lost her house because she couldn't pay for her house. So now this woman who had until that, a few months prior to that, had insurance, had a doctor, had a job, had an income, was suddenly taking care of this wound in the back of her car because she was homeless, with newspapers and bits of gossip she could get here and there whenever she had money. So inevitably the wound got worse, progressively worse and worse, and ended up coming to the hospital with a very bad infection and being basically contemplating the fact that her leg might have to be amputated. This is something that could have been prevented. This is something that could have happened to any of us. This woman, as I said, had an income, had a job, had a house, and this is happening to people throughout the country every day.